I'm Ahavaliptag. Welcome back to What Did You Learn? I am thrilled to have with me the great Michiko Tanabe, who is the Chief Marketing Officer at Stanford Health Care. Thank you so much for being here.
Thanks so much for having me. I'm so excited to be here.
Yeah, it's great. So tell me what your favorite ice cream was during the pandemic. Still, what are you eating?
Mint chip, my go-to. Pre-pandemic, current pandemic, post-pandemic. Mint chip, Cherry Garcia.
Oh, yum. There's nothing like a mint chip ice cream with chocolate sprinkles.
There you go. I can live off of ice cream. That's all I need.
Me
I'm
too,
good.
Unfortunately. So you are in a very interesting position because, first of all, geographically where you are in the country, you sit in the middle of some of the brightest minds that are sort of really pushing the technology forward. And you're also at one of the best, medical healthcare facilities in the world. When this started to happen, how did you think through what your strategy was going to be? Because everybody had to be reactive, but you also, on a certain level, because of where you are, had to be proactive. So how did you combine those two things?
Well, we didn't know what we didn't know as we went into this, but you're absolutely right. And I'm so fortunate to be here. So back in December, when the operations team, the clinical team saw it happening and playing out, they knew it was just a matter of time before it was going to get here. So they dusted off, as they say, the pandemic book. And we had just opened this new beautiful hospital that I sit in. And so it was like, okay, it was meant to be. What are we going to do? And so it was really going into command and control and setting up the infrastructure and adapting to what people expect from Stanford Medicine. And we were able to do that. But it wasn't without its unknowns and fear of unknowns as well.
How did you so you had to corral not only marketing and communications, but executives, get support, think through distribution of messaging. How did your day look those early days of the pandemic? And then how did you shift into okay, we're not every day isn't a panic, but how do we prepare for things?
Oh, it's not a panic? Are we out of that? Oh, I'm sorry. I don't, to me, the days, we still have these days. I mean, it was never ending, but I think part of it was, I do have communications and we really leaned on communications. Marketing, I'll be honest, we said, okay, we need to figure out what we're going to message, but it was really about communications and making sure that we were out there and calming the fear, because there was a lot of fear, a lot of unknown. What is it? What isn't? And California, if you recall, was one of the first to go to shelter in place.
Yep.
The governors, the mayors, we went into lockdown and we didn't know what that meant. And it was making sure that we were constantly ready to pivot. And we didn't know what kind of pivot we needed to do on an hourly basis. I mean, what I learned is once you knew the knowns, they became unknowns again. I mean, we constantly said, oh, it's fluid. It's a fluid situation. It's dynamic. It's fluid. If we never say those phrases again, it'll be good for me.
Yeah, I hear that. Although I don't have a feeling that the world is really going to stop being fluid. I think that that's, what we're dealing with.
I can dream.
You can. You can dream with your mint chip next to you. So Michiko, you and I are sitting here waiting for the Chauvin verdict to come out.
Yeah.
And it brings to mind the social justice issues. And in Northern California, particularly in Palo Alto, where you are in Mountain View, there's a very, very diverse population. When the whole thing happened and you're in the middle of dealing with the pandemic, and as you said, every day is a new day, there were some knowns and there were still some unknowns. Can you give us an inside look at what those conversations looked like as you decided how you were going to get out, either in front of it or side by side with it?
I don't think anybody's gotten in front of it. I'll be honest. I think we all have the best intentions, but I'm not sure, because as a country, as a nation, we haven't been in front of it, honestly. But I think we really leaned in, and I have an amazing leadership team that I report to that very much leaned into it and quickly stood up the pledge that turned into the commission and wanted to find out. And we were pretty honest with, we didn't know what we didn't know. And so this commission was set up to really learn and do some digging and find out some hard facts and some painful facts, honestly. And we had to be really honest with ourselves as well as the community and talk about what we were planning to do, but everybody has a bias for action. And for the first time, we said, yes, we need to have a bias for action, but we don't know what we don't know. So we have to just take a moment and figure it out and listen and learn. And so the commission was stood up. It is internal, external, and they're coming out with their findings shortly. I wish it were 2 weeks ago, honestly, as the verdict comes out. But everybody's leaned in. And I think the beauty of what we have here is everybody's open to learning. You're right. We have the brilliant and the brightest minds around us, but we don't know everything. And everybody's willing to have that self-awareness, but the open and the eagerness to learn, knowing that we're not going to get it right every time. I'll be honest, as we change our brand guidelines and make sure that they're more inclusive and everybody sees them in themselves and what we do, and we're connecting and talking to everybody, that's new for us. I'd like to say that it wasn't, but it isn't. I'm embarrassed to say, I'll be honest.
Well, I do think that, on a certain level, we should have been open to learning and we should have been more aware. And it's a terrible thing what happened, but it did break open a conversation that did need to happen. And I don't know how else we would have gotten to a point where we started saying to ourselves, something's not right here. And the good people, the people who want to be on the right side of history, need to fight their way through and figure this out. So I want to talk a little bit about digital, particularly where you are. And I interviewed somebody last week, and she was talking about how the history of healthcare marketing and the whole move from like advertising and then thinking through digital, and particularly where you sit. How much of your focus now is going to be really on being the leader in that space? Like, is it still the traditional mix of marketing? Do you feel the push towards consumerism? Do you think the pandemic, because of telehealth and getting messages out there, forced you to move in that direction? Like, is Stanford going to be on TikTok?
Stanford's going to be on TikTok. Is Michiko going to be on TikTok? That's a bit of a different story. My nieces and nephews are, which is great. They teach me every day. Absolutely. We need to be on the cutting edge. I think we get a lot of credit because of our brand. People assume that we are. And from a treatment perspective, we are innovative. From a marketing perspective, we're not quite there yet, but this has pushed us. All of us have learned so much from this pandemic and what we can do and what we should be doing. And that really, it isn't that hard. What seemed daunting a year ago, look what we've all done, not just at Stanford, all of us. And I hired a management team via Zoom, right? Wow. If you told me 2 years ago I would be doing that, I'm like, what? No, that doesn't happen. We're not doing that. So we've all opened our minds and our hearts. And yes, we are digitally driven, and the marketing team has a digital mindset. And how are we going to advance ourselves forward? We still are going to do traditional marketing. We have a very diverse population as well, and we can't assume that everything is digital, right? And let's not forget academic medical centers, as much as I love them, and I bleed cardinal red, we're not always the first to market with everything, right? But we're fast followers as well.
Right. No, that is true. I do think, though, that as we see this more and more shift, like I think doctors themselves, as I spoke to them throughout the pandemic, they were like, I always thought our senior citizens, or our elderly population didn't really know how to use these tools. And they're coming in and educating me about how to use them. And so, it's meeting the audience where they are, but also understanding that all of us have made this huge jump towards digital. I mean, how many people have played trivia nights with their family on Zoom? Like, eventually you figured it out and you're like, Grandpa, I got to unmute. So, it's that kind of thing. So you and I are sitting in Palo Alto, hopefully really, really soon. And we are eating our mint chip ice cream at like the best, ice cream shop that you've got in that area. And you're making chocolate sprinkles on my cone. And I'm going to say to you, Michiko, as a CMO and even as a person, because obviously you bring that to your work, what tool did you sharpen or put into your toolbox that you are going to continue to use for the rest of your life, for the rest of your professional career?
I think it's not so much a tool, but it's an attitude. So it's perspective and purpose, and not to be afraid of anything. Because if we can all get through this, and we've all had our different circumstances professionally and personally, you have the sandwich generation. I have folks that are working out of a closet because we went to shelter in place and our building closed down.
Right.
So we weren't supposed to go in there, and you can't make assumptions that people have space to work remotely. Where are they? But it's also perspective. At Stanford, we were very fortunate. We had the surges, but we had ICU beds. We had ECMO available. I mean, we are in a very fortunate area. And so it's just reminding myself of perspective, not only for myself, but for the team and the organization at large. And also for purpose. Whatever we do, it has to have purpose because of that perspective. I mean, and probably still do things without purpose, but things have more meaning now. I think everybody just has a heightened sense of awareness about life around them. So it's not only for my personal life, but my professional life and for the team at large. As we know, there's 100 things to do on our to-do list. Are they really that important? Probably not. So what does that really mean? So I think it's not so much a tool, but it's an attitude and a perspective.
And it's perseverance, to add another P, right? Like,
yes, and you know me. That is actually perseverance, is it, right? And
right,
so
grit. Yeah.
We also do the C's around here, right? It is to make sure we have the context to calibrate, right? And do it with conviction.
Silicon Valley, baby. So one last question, and this is a new question. I haven't asked anybody this, but the idea that you talked about with the purpose, do you think there's an opportunity now that we watched all of these health disparities and we saw that our country really suffered because we focused on healthcare rather than health? Do you think you're going to see that shift as well?
Absolutely. And I think we all are seeing the shift already. And it's really a matter of how do we go about the health disparities, whether it is delivering the clinical care or from a marketing and communications perspective, meeting those populations where they are, not expecting them to come to us, but really meeting them and not making assumptions and taking technology for granted, taking words for granted, right? It is really just making sure that we all have a wider lens of how we look at things.
I love that. That's great. How can people reach you?
LinkedIn, pretty much, because I'm not on TikTok yet, and that would not be pretty anyway. So pretty much via LinkedIn.
That's
or
perfect.
I'm sure on here, you're going to share my email address anyway. So it's all
no,
good.
I'm not. That is something I keep private unless people put it out there. But what I will tell you is that I will ask everybody who watches this to find Michiko on LinkedIn and harass her to join TikTok so that we can see her.
Pressure works. I will admit, peer pressure works. I am an unusual CMO in the sense that I like to be behind the scenes. I really do. You know me well enough, Ahava.
Yes,
I like to be behind the scenes. One of these days, I did commit. At some point, I will be on TikTok. It might be passé by then, but you never know.
No, I think we have a few years left of TikTok. Clubhouse, it'll be interesting to see what happens with
that
one.
Yes, but I would like to say, and it could be up for sale, you never know. My nieces and nephews are horrified because I got a Clubhouse invitation. I am the last person that should have a Clubhouse invitation. Just got to say.
Yeah, I think it is gonna sell soon. And I think it would be smart to sell soon because I don't know how popular it's gonna be after the pandemic. Like, I think once people can get out there, it'll be different. Well, it was wonderful to see you and to have this time with you. And I really appreciate that you took the time, especially in such a pressured environment. So thank you very much.
I appreciate being asked and honored to be able to converse with you. And I'm looking forward to those days of mint chip.
Yes. I can't wait. Thank you.
Thank you. Have a good one.